Hello, welcome back to the International Stroke Meeting here in Honolulu, Hawaii. I am Louise McCulloch. I am the Vice Chair of the Program Committee for the ISC, and I'm here with our Chairman, Miguel Perez-Pinzon. And we're going to sum up a few of the highlights today. I think, Miguel, you're going to speak about the Enchanted trial.
Yes. So the Enchanted trial is this trial that is looking at lowering blood pressure in clot-busting therapies. So it's well known that with TPA and some of these treatments, there is a potential for bleeding in these patients. So the approach here is to lower blood pressure more aggressively over 3 days and to see if that affects the functional outcomes later on. So that's basically what the trial is all about. Is 3 days of treatment lowering to 140 millimeters of mercury, the systolic blood pressure. And they basically found that there is no difference in functional outcomes up to 90 days in patients that were aggressively, the blood pressure was aggressively decreased. But the bleeding actually decreased in these patients receiving TPA treatment. So I think all in all, answer an important question, and it's an important trial.
Great. And speaking of the other side of ischemic stroke and the consequences of giving TPA, I'm going to discuss the MISTY trial, which was also completed. As you know, that is a trial for minimally invasive clot resection and clot removal in patients with intracerebral hemorrhage. Intracerebral hemorrhage is a very difficult disease to treat. It can be very devastating, and the blood that's in the brain probably has a lot of inflammatory effects. So this trial was really designed to see if that blood was removed relatively early in the patient's course, would that improve outcomes? Overall, this trial was very well done and enrolled a large number of patients, but showed no evidence of efficacy at their pre-specified outcome. So there was no difference in modified Rankin scale in the patients that either underwent clot resection and those who did not. There was also no difference in mortality, although there was a trend to a benefit in mortality. Interestingly, from this trial, there were two things that I think are very important to mention. One is about patient selection, and we have learned this in ischemic stroke and doing thrombectomies. Who is the best patient? Who is the patient who is going to benefit? Intracerebral hemorrhage is now going in this same way. It did appear that there was a benefit for patients who got clot resected and were left with very residual clot, less than 3 tablespoons or about 15 cc's. So those patients had a trend to benefit. So it may be a question of selecting the right patients, getting the clot out perhaps earlier, and we should be able to see benefit from these therapies. The other very interesting finding in this trial, which was somewhat unexpected, is how well the patients did, both in the medical arm and the surgical arm. Intracerebral hemorrhage has always been thought of as a devastating disease with very poor functional outcomes. Interestingly, 40% or 41% of patients actually did well with relatively good modified Rankins. So it tells us a lot of how good a job we are now doing in the medical care of these patients, because both the medical arm and the surgical arm did much better than expected. And this may be very important when we think about things like withdrawal of care in these patients, that we're really telling the families about what the outcome can be expected. So I think it was a very, very interesting and useful trial. I think we'll have to see if patient selection can be used to treat these patients. We also have some really exciting things happening this evening. Poster-led professor tours are always very well received. We have a tremendous number of late-breaking posters. We have awards coming up, so I think we have a lot on the docket. Anything you wanted to highlight?
Yeah, so also we have Game of Strokes happening. That's this exciting competition between different regions of the world trying to diagnose clinical cases, very difficult clinical cases, is basically for education. And I think it's an exciting thing that we have in ISC.